decided to do our Physiology and Anatomy career project on physical therapy.
My name is Chris Shalanik. I'm a physical therapist. Good afternoon. I'm here to help you guys find out about physical therapy. So, what kind of questions you guys have? For my undergrad, I went to St. Mary's College, which is up in the Bay Area. Got a bachelor's in science, health, human performance, with the emphasis in sports medicine. After that, I became an athletic trainer and did athletic training for the high schools and colleges and worked in a physical therapy clinic, much like this one, an outpatient orthopedic clinic. I then went to Loma Linda down south and got my doctorate in physical therapy and graduated in 2009, took my boards, and now I'm a licensed physical therapist with my doctorate. It was 4 years undergrad and then 3 years for PT school, so it's about 7 years, you know, and now they have entry-level courses where you can do, you know, get your bachelor's and, you know, your PT license kind of all lumped together. That's what Loma Linda does. It's called entry-level bachelor's of science with a doctorate. So you go in without a bachelor, you come out with a doctorate. Pretty good, huh? So you get both. You get a bachelor's and a doctorate. That's Loma Linda University. They can pay back some of my student loans for saying that. Thank you very much. Actually, in high school, I was injured as an athlete and had to go to rehab and just saw the environment. Really appreciated, you know, I like being around people and saw an opportunity where I could help people help themselves get better, get back to enjoying life, and I just fell in love with it. I was really on the bubble, didn't want to know if I wanted to be a surgeon, you know, wanted to go and wasn't sure what I wanted to do, and I just found myself really gravitating towards working with people and helping people help themselves get better. And that's what we do as physical therapists. We pass on the knowledge we have of this human body here, and we say, here's what you got to do, and here's how you're going to do it. And people, you know, get to meet a lot of people. So basically, I like helping people. Like I said, you have to now, they offer doctorates and masters in physical therapy. Before it's just masters. Now they offer a master's or a doctorate, and in some states you have direct access where someone can come off the street and just go see the physical therapist. You have to have a doctorate for that. Okay. In California, we don't have direct access, so you have to have a doctor's prescription to see the therapist if you want to have the insurance pay for it. So basically, you have to have either a master's in physical therapy or a doctorate in physical therapy. But you can, like I said, do some programs where you get a bachelor's in science and end up at the end walking away with a doctorate. On a daily basis, what I do is people come in the door and they tell me what's hurting, and it's my job to identify exercises and stretches and what we call modalities, whether it's heat or ice, electrical stimulation, to put together a complete program to help them, one, prevent or alleviate the pain they're having, whether it's because of tight muscles, poor body coordination, mechanics. For instance, they might have some sort of orthopedic condition where they don't have cartilage in their knee, and because of that, they've been walking different. Now they've got back pain. So basically, identify what's causing them pain and show them things that they can do to either, one, if it's tightness, stretching it, or if it's muscle weakness, building it. If it's coordination, like a baseball pitcher, working on the mechanics. And then we do massage, and we do you know, mobilizations of joints, and actually we have some people who can't get their knee bending because after surgery, you know, there's scar tissue, so sometimes I've got to be a jerk and push on people and get them going. But mainly what we do is educate and teach people exercise and things that they can do, and then we kind of help give them the push that they need. But that mainly each day could be something different, but we have patients, they come in, we evaluate them, they take them through their treatments, they'll do exercise and they'll get heat and electrical stimulation, ultrasound, whatever each particular patient needs. It's not a cookie cutter recipe. We don't just say, okay, here you go. Oh, you're here for your knee. Good luck. It's, oh, what's going on with that knee? Let's talk about it. We see what functionally, like if you play soccer, then we start talking about different mechanics and try to incorporate an overall program to get you basically, you know, able to do the things you want to do without being painful. It's easy to say, oh, it hurts when I do this. Well, don't do that. So what we do is we find out what the patient's problems are, and we help address that any way we can and teach them how they can also do it so they're able to, you know, kind of prevent this from recurring if it's something that is from repetitive motion or just from bad posture. You know, I actually was fortunate. The funny thing is, the owner of this facility was actually going through and a student, athletic trainer slash PT student, and as they went through the ranks and they graduated, then they became the directors of the clinics. Then I worked for one, Sean Callahan, and then Patrick also was one who used to cover my games, who started his own clinic through doctors, and then basically they said, let's start our own, and So to get hired, no, there's a good demand for physical therapists, but with a lot of changes in healthcare, it's like anything else, access into it. It's a little bit harder, but it's like most things in life, unfortunately. If you volunteer and you're with a group of people, you establish that rapport, then it's quite easy actually to get down the line. There's different things you can do, anything from working with infant children to geriatric patients who are much older. What we do here is orthopedic, which is mainly muscle, bone, joint, neuromuscular. Any physical therapy, anything that involves, people being able to live independently. Occupational therapy will help them eat. Physical therapy will help them move and be able to complete functional activities. Oh, physical therapy. Let's see. Well, at Loma Linda and the APTA is the science of healing and the art of caring. So there's scientific and clinical based things that we use, but really it's about helping the people identify what's causing them, the issues, and working them through it. So basically, physical therapists help people help themselves get better. That's really what we do. I don't say, you come here and I'm just going to work on your closed eye and Karate Kid. Okay, it's, hey, here's what's going on with your body. See this muscle here, it's not working properly. Let's work on this, and this is an exercise that can help get that muscle back in tune, doing what it's supposed to. Because what happens is, maybe the problem's here, but the people will be using their shoulders. You'll see people lifting like this. Now these muscles are tight, now they can't lift. So we've got to say, let's start over, and let's just do baby steps and get you moving better and better. Because in order to get your hand up here, yeah, you can do it like this, but now it's causing other problems. So basically it's using science and using the knowledge of the human body, and then taking that, giving it to the patients, and then having them take an active part in going through the healing process. So it's very interactive. It's not just you come in here and here's this little magical thing, and here's this machine we're going to put on you. It's a lot of exercise, it's a lot of stretching, and most importantly, it's a lot of education for the patients. And these are our bodies, so knowing how to take care of them. You guys are young. As you get older like me, you get older and older, you want to be able to, prevent that. So stay active. That's for all you kids playing video games and going to textbooks all day and doing that stuff. Currently licensed for 5 years, but I've been doing it for 13 years. So I love it. Yeah, paperwork is the only bad thing, but guess what? All jobs have paperwork, so can't get away from that. But now it's going to be computer work, I should say.
That was pretty much it. Did you say you had questions for us?
No, I just,
Okay.
So what are you guys?
We're juniors.
You guys are juniors? And so is this for like a sports medicine class or just career development?
Physiology and Anatomy. Yeah.
Oh, awesome. Okay, so I used to be a lab aide for anatomy, and everything we do is right here. So all those muscles that your teacher's making you guys memorize, what's the point of this? And that's the important thing too. I could sit here and be like, well, your biceps brachialis and your trapezius, and what I explain to people is this muscle does this. But, human anatomy and physiology, very important. And I used to love doing that. So TA, and I'm fascinated by the human body. It's just such a beautiful piece of work, and to understand it and try to bring it back into balance. And unfortunately, I wish I looked like this with all these rippling muscles, but it is what it is. So I was just kidding you guys. So I'm glad I helped you, and any of you guys out there that want to come check us out and volunteer, that's something that we do too. We have people come volunteer, and then eventually you see if you like it. That's my advice to you. Before you commit yourself to doing something, get absorbed with that, spend some time with people who do it, and see if it's for you. Okay, so you guys, it was awesome. You guys have any other questions? No? All right. Thanks a lot.
Thank you.
Here are some demographics on this career. So, it looks like 10% have an hourly wage of $15.59 per hour. 25% get $20.24 per hour. The median, which is 50%, gets $25.08 an hour. 75% get almost $30 an hour. And 90% get $34.96 an hour.
We chose this project of physical therapy originally because Angelica had a physical therapist appointment, and so we thought, hey, why not do physical therapy, because it sounded interesting. And then that didn't work out, so her appointment's next week, and so we didn't have enough time to do our project. And then my dad has a physical therapist, so that's the person we interviewed at Star Professional. Is that what it is?
Star Physical Therapy.
Star Physical
Professional.
Therapy.
Star Physical Therapy.
Yeah.
Star Physical Therapy.
And it actually turned out pretty interesting. So I'm glad that we stuck with the topic.
Personally, at first I didn't think physical therapy was a career that I would like, but after this experience I realized that they help a lot of people and make them happy, and you get paid a lot, and I like that, and it's something that would be interesting to do, but who knows?
That's all, folks.